So you've just had unprotected sex and you're wondering on what to do about it. So if you're that person who've had unprotected sex and you're like, what should I do next? What am I supposed to do? What am I not supposed to do? This video that I'm going to be talking about is definitely for you. Welcome, guys. Welcome to Let's Learn with Nice Grace. If you're new to this channel or you're just coming across this channel, my name is Grace Ezekiel. I'm a registered nurse. Thank you so much for stopping by. If you're my subscriber, thank you so much. As usual, I don't take it for granted, and I will always say I don't take it for granted, guys. So if you haven't subscribed, please make sure that you subscribe to this channel. So as you can see from the title, today I'll be telling you about unprotected sex. What can you do after you've had unprotected sex? So if you're the one who is really interested in this video, please make sure that you watch this video until the end. So let's get to the video. So what is unprotected sex? So unprotected sex is basically having sexual intercourse without protection. It's just as the name goes by, unprotected sex, having sexual intercourse without protection. So it normally happens when maybe someone forgets to wear a condom, or when maybe someone had a condom, yes, they put on a condom, yes, but it split during the process of actually having the sexual intercourse. It normally happens especially for those people who are very, very dry during this process, and maybe those people who uses some lubricants that causes the splitting of the condom. So another thing, it might also be for those people with one night stand. So I've been also having people in my DM telling me, oh, I had one night stand with someone and I can't even remember the person, but what can I do now in order for me to prevent this and this? So I'm here to answer your question, guys. I'm here to answer you. So this is what you're supposed to be doing after you have unprotected sex. So if it was a one night stand, you just went for a club, for clubbing, or maybe you went to a party, then you met someone there, you started like maybe romancing and doing other stuff, then you find yourself maybe in a hotel or in a room somewhere the next morning, and you just find that maybe you had intercourse and you had no protection. This is the video for you. Please make sure that you watch the video until the end. If you know that after you've had this unprotected sex, there are consequences of you having unprotected sex. You might get pregnant, or you might get STDs or STIs, or you might have HIV/AIDS. So you know that because we normally talk about fertile days and the safe days. So it doesn't matter. Even if we talk about the safe days and the fertile days, it doesn't mean that when you practice sexual intercourse during your safe days, it doesn't mean that you're not going to get pregnant. There's still a high chance that you might get pregnant even on your safe days. It's just something that is there, but there's a possibility that you might also get pregnant during this period. During this period is, let's just say, about 50-50 chance you might get pregnant, you might not get pregnant. So in case you had unprotected sex during this period, don't tell yourself that, yes, I had it during my safe days, then there's no way I'm going to be pregnant. Yeah, it might be true. There's no way you might be pregnant, but again, there's a way you might be pregnant. So what do you do in case you find yourself in this scenario? So what happens is that, so because I've been having people telling me that I had sex, but I was protected. Then I ask you, did your partner put on a condom or something? Then the person will say, no, we did not put on a condom, but I myself am using pills or something, or maybe I have an IUD in place. Then that's okay. You've protected one thing, but you haven't protected the other. We just talk about one protection. We forget about talking about another protection. If it's a couple, then yes, it's okay. You can protect pregnancy, especially if you don't want like to have babies during that time. That's well and good. But if you're that person who is not like preparing to have any kids, then make sure you protect yourself against having any babies or against having any STDs or HIV/AIDS. What happens for you in order for you to try and prevent getting pregnant? So the first and foremost thing is taking emergency pill. So emergency pill comes as just a single pill in a it's just come as a single pill, of which it needs to be taken at least as soon as possible or within 72 hours after you've had unprotected unprotected sexual intercourse. So this emergency pill basically works to prevent you from getting pregnant. So that is what happens basically, but it will not prevent you from getting STDs or getting HIV. So we will just be talking about prevention one by one. So let's talk about preventing pregnancy, of which we've talked about the emergency pill. So once you take the emergency pill, then it's better for you to, like, you might experience some side effects. You might have like nausea and vomiting. You might there are those people who might experience dizziness, and maybe you might have, like, during your next period, it might come as a heavy flow or something. It depends. And I will also tell you, if you took this emergency pill and within 2 hours of taking the emergency pill you vomited the pill, you can see it, you vomited the pill out, then I would advise you to take another pill as soon as possible, because the pill hasn't worked in your body. Don't just say that you've had the pill and you've vomited and then there's some that has gone in. A complete pill has to go into your body. So if it hasn't gone in, then there's a possibility you might get pregnant. So if you vomited within 2 hours, then I would advise to take another pill. So those are the side effects. So what happens if you find yourself having unprotected sex again, maybe another time, then I would also advise you to take another emergency pill. It's not that if you took that one, that maybe you had unprotected sex this week, you took the pill, maybe then you had another unprotected next week, then you say that I took a pill last week, so that's enough, that will get me through this week too. No, it works at that time, it works during that time. So the one that you took last week, it's over already, so you need to take another pill. And if you're this person who keeps on having unprotected sex, then it's honestly better for you to, like, have this regular contraceptive, either the pills, or you can choose of maybe having IUD. This is the intrauterine device. It's just a coil. It's a coil, like a T-shaped coil. So it comes into two. There's either hormonal or non-hormonal. So you can choose whichever you want. And the doctors are the ones who nurses they're those people who are trained to insert the IUD into place. The good thing with this IUD is that it can be inserted at least 5 days after you've had this unprotected sex. And also, it is 99% effective on preventing of pregnancy. And also the best part of it, immediately once it's inserted, it starts offering you the protection that you need. So it's not like other pills or other, maybe the injections, of which you've got to, like, have to wait for another maybe like 7 days or 5 days, depending on whatever you're using. This one offers immediate protection. But before that, it's better for you to, like, test that to make sure that you're not pregnant before. You might insert it and maybe you're pregnant, and other consequences or other things that might come into having IUD. You might have, like, ectopic pregnancies, like heavy bleeding. So there's other side effects of having IUD in place, but it's actually one of the best family planning that you can use. So if you're that person who likes prone into having unprotected sex, then it's better for you to, like, have regular contraception. If you choose the pills, if you choose the injection, if you choose the IUD, better for you. At least they're going to be preventing against having unwanted pregnancy and maybe going ahead to do some abortion, of which they might lead to a lot of things, maybe death, maybe losing your uterus, in case they're not done the correct way. So it's better for you to prevent. Prevention is better than cure. So if it's better for you to try and prevent it instead of curing it. So the next thing you need to do is take a pregnancy test. So you can take a pregnancy test up to 2 to 3 weeks after the first. You can take a pregnancy test within 2 to 3 weeks after you had your unprotected sex, or you can say just about a few days after you've ovulated, if you're that person who knows when he's or she's ovulating. So you can do a pregnancy test after that. If it comes out positive and you don't want to have the baby, then you can talk to your doctors and they can help you with that. If it comes out positive and you want to keep the baby, then well and good, you can go ahead and start your antenatal clinics, and the doctors will guide you more on that. So the last thing on the preventing of pregnancies, it's better for you to plan on future contraceptions. So make sure that you plan on for future contraception, and know, as I have mentioned earlier, there are varieties of contraceptions that you can use. Better for you to go and speak to your health practitioner so that they can advise you on the best one to use, because whichever contraception that is going to work for person A and whichever contraception that is going to work for person B is very different. We have different bodies, so you might find that this one is working for you and this one is not working for another person. So if you speak to a healthcare provider, then they're going to be able to advise you on which one is the best, and in case you use one and it's not suitable for you, then they're very able to change you to the next one. So that's it for the pregnancy. And for us to prevent, the second one is preventing the STIs and the STDs together with the HIV. So what do you do in order to prevent this? So the first thing after it, it's very advisable for you to go pee, go to the toilet, try to pee. Then you can have a shower, have a nice shower. You can wash your vaginal area, just wash with lukewarm water, not like scrubbing using a lot of soaps or fragrances. And also it's advisable for you not to dodge. For those people who like dodging, it's very advisable for you not to dodge, because the moment you start dodging, then it will increase the risk of infection. So better for you to like just clean it with lukewarm water and just wipe it very well, gently. And then you remember it's your flower, so you need to really take care of it. So it's advisable to just clean it very well with lukewarm water and let it be. So another thing is for you to book an appointment with your healthcare provider. So I know normally most people don't really like talking about this stuff. They don't like talking about these STIs and whatever. So it's very, very important for you to like try and talk to your healthcare provider. Just explain your situation and let your healthcare provider do some tests on you. So the healthcare provider might take a swab on you. They might do like HPV tests. They might take some blood samples from you. They can also do some urine tests. All these tests will help the healthcare provider to identify if there's any STIs that you might have contracted during that period. So we say this, but you know that in order for you to get this infection, in most cases, it takes a lot of time for it to come through, for it to actually show. So it's better for you to like, even after you've visited the hospital, you've just been given treatment and everything, it's better for you even after a period of time of which the doctors are going to be advising you on. After a period of time, maybe like 3 or 4 weeks, to go back and let them get to test you, because there are these symptoms that you might have. There are these STIs that might come later on after a few weeks. That is when they are going to start showing. They're not going to start showing immediately, but later on. So it's better that even if they've given you treatment on your first time, just go back next time so that they can do some other tests and make sure that you're safe from any STDs. So there are these STIs that are very easy to treat, such as gonorrhea, such as trichonoma, such as chlamydia. So these STIs are quite easy for them to treat, because they just give you some antibiotics and some antifungal medications, of which they're going to be helping you to cure these infections. So it's very easy. In case you have this, then it's very easy to be treated. But there are some STIs that are very, very difficult to be treated. For example, HPV, for example, another one is herpes. So if you've got this kind, and hepatitis. So if you've got this kind of STDs, then it's very, very difficult for them to be treated. And most of these show in later on in life, and maybe after like even up to a month, 3 months, even 6 months. So it may take time for some of them to show. So it's better for you to continue doing regular checkups after you had your unprotected sex. And if you know the partner, then it's better for you to both of you, if you can go get tested and get the treatment, it's honestly better for both of you. And there's these signs and symptoms that you might experience, like maybe swollen vulva, you might have like spotting, some little bit of bleeding, some itchiness, and maybe some other abnormal discharges or vaginal discharges. Then you might even have smell like in trichomonas, you might have like smell of other things like fishy smell. So it's better for you to, if in case you have like these symptoms of STIs, then it's better for you to try and seek medical advice as soon as possible. So, and if you inquiries that maybe your partner has HIV, then it's better for you to try and seek, your healthcare provider is also going to do a test on you, then they can prescribe some PEP on you. This is prophylaxis to prevent you from having HIV and AIDS. And if you're on this medication, I would advise that you make sure that you take this medication as advised by the doctor. Make sure you eat very well, and during this time that you're taking your medication, make sure that you are not practicing any sexual intercourse, especially unprotected sex, because you might be treating something and also having to acquire other things. So it's better for you to try and abstain during this period. If you've got a partner, both of you try to abstain until both of you are well recovered from these STDs. So that's it for the prevention of pregnancy and the prevention of STDs. So in case you had unprotected sex, don't panic, don't start to be scared and everything. Just do whatever I've told you, and I know everything is going to, with time, you're going to try and settle up and make sure that maybe you try to limit yourself and avoid such scenarios from happening. Thank you so much for watching this video. If you liked the video, please make sure that you like the video. Subscribe, make sure that you subscribe to this channel. Thank you so much for watching. Goodbye and see you on my next video.